I would like to emphasize as a medical doctor the importance of this resolution, because we know 2/3 of people who need medical care, mental care, and the psychosocial support have no access to care and treatment. And we know every year 800,000 people die due to suicide and millions attempt. So I congratulate our colleagues for this resolution. IFRC congratulate the team and all movement component to come up with movement-wide MHPSS policy, which will provide uniform and coherent approach to MHPSS needs of the people in the context and at all times. Pleased to see that the policy reflects the work that national societies, the IFRC and the ICRC does in developmental, humanitarian and emergencies, prevention, preparedness, response and long-term recovery settings, and is ambitious to bring us forward and claim space in MHPSS ecosystem at community, in national, international and global levels. Particularly important to note the statement in policy focus is to ensure impartial access to MHPSS services and specifically prioritizing prevention and early response. We from IFRC commit to include MHPSS in all emergency assessments and the subsequent plan of actions and emergency plans within the movement. Impartial access is also ensuring early detection and interventions with children to prevent mental health conditions from developing, and also the accompaniment and support aspects of IFRC's work across the life course. Besides, I personally like that policy has recognized and focused upon caring for staff and volunteers that relates particularly to the duty of care issues of IFRC towards its own staff and in terms of national society development, a core mandate of IFRC. I know the setting up caring for volunteers SOPs, policies and systems is something that the IFRC PS Center have been working on with a number of national society over the past 5 years. The proposed resolution calls upon the movement to adopt this policy, allocate more resources to MHPSS with the view to strengthen capacity, guarantee a minimum MHPSS response, and for the ICRC and IFRC to monitor and document progress around the policy. The COD resolution MHPSS policy is also pertinent for the resolution on restoring family links directly after this session. The IFRC is committed to support national societies and the Federation to operationalize this policy in all their work. I thank you.
Thanks a lot to the delegation of the IFRC. Let me just